What is up, my fellow YouTube nurses? Can I first just say I apologize for not putting a video out for more than 2 weeks. I've been busy working my 8-12s one day in between with a break. It wasn't enough, so I was so busy, tired, and just resting and hanging out with the fam for Thanksgiving. By the way, it was delicioso. La comida estaba bueno. It was good. It was delicious. But can I say one more thing before I go any further? I got love for my subscribers who be rolling with me. Alright, can we get serious? First off and foremost, let's talk about the most important question of the day, which is from Giblet Lover. That's a funny name, Giblet Lover. I don't know what kind of giblets are and I don't know what a giblet is. I don't care. But his name is funny. And he asked, why don't men break into boundaries in nursing? I would love to talk about that. Okay, so that's a very good question. And I honestly think why men aren't breaking the boundaries of nursing is because they think it's a stereotypical female-dominated career, and they get nervous just because when you have to take orders from another female, or you're getting scrutinized, or you're under a microscope from other women who are instructors, they just can't, I guess they don't know how to take it. Honestly, I'm going to put this out there. I had one guy in my class, we had about 5-6 males in my clinical group, and she basically told him to go home just because he was wearing the wrong pair of shoes, and you need to have a certain type of shoes for the clinical setting. So anyway, he got sent home, and I never heard from him again. He was sent out. He was a military individual, so I guess, I don't know what it was. Maybe taking orders from a female wasn't what he liked. But to me, you gotta suck it up, man. You gotta put your, cojones, put them up in your pants, and walk up and keep your head straight and take those, what they call constructive criticism, and don't take it personal. I mean, that's how you learn. So anyway, I think maybe men have, they were maybe a little nervous getting regulated by a female, but you know what, you got it, man. You just have to. That's the only way to learn. And this is what's important, is that it's constructive criticism, so they're here to help you. And a lot of men probably don't know the classes they need. Maybe they need some help of enrolling. Maybe they think it's just going to be just for females. And I could understand that. You go in a hospital, you see all the men there. They're doctors, maybe physical therapists, x-ray technicians. You see them, but as nurses, more female. It's understandable. I got that. But check this out. I also read about a survey that I think it's approximately 5.4% of the 2.1 million RNs employed in the nursing in the US are men. That's 5.4%. Are you kidding me? That is below the bottom. I haven't even heard about that. It just makes me realize I'm one of those 5.4% of the people in the US as a male nurse. So I mean, it's changing every year, but I feel like, it's just ridiculous. I figured it's a good topic, before the beginning of the new year, and I figured let's talk about it. And also, another survey they also I read was 13% of students enrolled in nursing schools in the U.S. are men. So that's above 10%, but still though, 13% is not enough. So we need to get more males in here. And I honestly think maybe they get afraid or they're scared that you're dealing with a female-dominated profession. But let's go into some statements or reasons why male nurses went in the field, and I have to talk about it. It's funny. Here's a couple that I saved so you can, read it. Well, I'm going to read it to you, so listen to this. A male, this is what he said. His name is Jackson145. I needed a profession that was into nursing, that was always in demand. I never seemed to have developed a soft spot until I started working with the elderly. So that's okay, good reason. Here's another one. Brian77. I've always wanted to go into nursing and medicine, which why I graduated, but don't have the patience for med school. Nursing has great pay. I am able to have and help others with many opportunities and flexibility. So that's good. Help others, flexibility. That's a pretty good reason why I went into nursing. Here's another one. Being around women. What? There's a lot of women, I understand that, but listen to this. That's cool, don't get me wrong, I love women, but they can be very emotional and tough to work with. That I agree. Sorry girls, I know you guys check out the channel and everything, but emotional trains sometimes. Whoo, it just comes through, and sometimes I gotta just stop it, but that's a different story in a different video. Let's talk about this other gentleman right here. Main reasons: good pay, security, benefits, indoor job, advancement opportunities. Those are good 5 reasons. I like that one. Another one is nursing was, I went into nursing and became an RN after a horrible experience at a local hospital and realized I needed to help others. Okay, so wanted help. Here's another one. It's a pretty cool feeling when you help others, and global travel opportunities. What better way to see the world than lending a helping hand all over the globe as a male? That I like. Another one is right here. Nurses can swap hospitals for easier than doctors. I'm looking forward to work as a civilian for the Army in Germany or Sweden when I finish nursing school as an RN. I like that. So he's into nursing school so he can travel. Last but not least, the most important one that I think that a male is becoming a good nurse is, his name is Ray6387, says, I'm a nurse simply because I knew it from the start that it is one of the most fulfilling jobs on earth. It is living on my purpose, and I'm proud to say that I am man enough to be a nurse. No need to prove anything to get a manly job done. And that's a good reason. I like that. So I'm going to end it on that note. It's a pretty good reason why he wanted to become a nurse, because it's a manly job. Anyway, let's talk about this for you guys. Put your little statements and questions anymore if you have on the bottom, and just ask me or let me know, why do you think there's not enough males in this nursing field? You guys let me know, because we need to increase this, guys. We need to get more males up in here. So I'm going to end it on that note, and I'll do another video, guys. I know I haven't been doing it right after day by day, but I've been working so much. So this whole 2 weeks is too long. I might do another one, because that's 30 years in YouTube years. My bad. But I'll do another one soon. If you guys have any more questions, let me know, guys. My fellow YouTube nurses, I got to tell you one last thing, and that is, I got love for my subscribers who be rolling with me. Alright.